We're in an era that is going to be defined by the amount of environmental damage that mankind has done to the planet. And I think we're becoming increasingly aware of what the impact that we've had is and we continue to have. Hi, my name's Matt Sawyer. I'm a doctor and a practicing GP, and I've done this for about 25 years now. But I've also been back and retrained in environmental issues, and particularly around sustainability and carbon footprinting and carbon literacy. I've moved into the world of sustainability, and particularly with healthcare. And one of the questions which is often asked is, why should we care as healthcare professionals about becoming more sustainable? Well, GP training and medical training has equipped me with the skills to see patients, to diagnose illness and treat the various ailments that we find, to hold the hands of the dying and look after people at the end of life. But it hasn't really given me the skills that I need to practice medicine sustainably. We live on a finite planet with finite resources, and medicine's always had to fight for its share of the pie. But we can't be profligate or wasteful with the resources that we have. So it's increasingly important, and ever more so now, that we practice medicine in a sustainable manner. I'm often asked, what is sustainability? Sustainability to me is succeeding economically whilst also improving the society around us and reducing our environmental impact. I completed a Master's in Environmental Management and Corporate Sustainability at York University. The dissertation was looking at the barriers to sustainability for small and medium-sized businesses. I can help your business to identify your barriers and put actions in place to improve your performance. Practicing medicine sustainably means making use of the resources that we do have and not at the expense of future generations. It means practicing medicine as if we were going to live forever and changing our behaviours accordingly. To practice sustainably, we must be aware of the impact that we have on the planet around us, about the resources that we use, and about the things that we may be wasting. An environmentally accountable business is both responsible and responsive. They are aware of the global challenges that we face and the environmental impact of their actions and the role that they play. Clinicians may argue that it's not our role to protect the planet. I would argue that actually, we're not about saving the planet, this is about saving mankind. The planet's going to be here for the next 7 billion years, whether mankind is or not. One of the important roles of a clinician is to prevent ill health in the patients. The General Medical Council recognises that it's part of our duty and our role to protect and promote good health for the population. Carbon literacy is the awareness of carbon costs, the impact that it has on our planet, and motivations to make the changes. All of our healthcare has got a carbon impact in one form or another. And to me, it's as important knowing what the carbon cost of a procedure or a treatment is, as it is to understand the calories in our food or the number of alcohol units in our drinks. For us to be able to practice medicine sustainably, we need to understand where the carbon hotspots are and what we can do to reduce them. There are many greenhouse gas emissions from healthcare. They come from the energy that we use to heat and light the surgeries and hospitals that we work in, from the travel from our patients and from our staff, from the equipment and consumables needed to diagnose illnesses, or from the manufacture and distribution of drugs, or from the waste that healthcare produces. Businesses can benefit from going greener and practicing more sustainably. Energy, for example, is an area which often costs businesses a lot of money, but also generates a lot of carbon emissions. We can help by performing an energy audit, looking at where the energy is used and where energy might be wasted. And we can also help empower your team of staff to change their behaviour to save you energy and to save money. Becoming carbon literate means not only reducing our carbon emissions today, but also planning for anticipated events tomorrow, and putting in place what we need to do to adapt and mitigate to the worst eventualities. We can start by knowing our own personal and professional footprints. We can then help you plan the actions for you to reduce your environmental impact and take pledges alongside others to do the same. If we don't become carbon literate and start tackling our carbon emissions, the climate crisis will get worse. We will be on the front line again in healthcare. We can do things to make the changes that we need to do now, rather than wait for disaster to strike. We provide an online course in carbon literacy for healthcare staff. This is accredited by the Carbon Literacy Project. It's available online and sign up through the website. It is the first of its kind in the country and has had excellent feedback from the participants so far.